Let's have a look at the fourth wave of COVID-19 now. Health journalist Lopez Gonzalez joins us. Laura, good afternoon to you. There does seem to be a little bit of evidence, it's early days, but a little bit of evidence that this wave, the fourth wave in South Africa, is behaving slightly differently to the other waves. How significant is this evidence? Is it possible to say at this stage?
Right, we're certainly seeing that. We're certainly hearing from experts, both on Gauteng and at the national level, that wave, this wave that we're currently in, looks like it could be above the third wave. The key difference there being that we're not seeing the kind of hospitalizations and deaths keeping pace with these extraordinary numbers that you're hearing as those diagnoses increase every day. So Gauteng epidemiologists telling us just last week that they're not seeing those hospitalizations and deaths keeping pace with those increases. And they think that that's largely because of the vaccine protection that we're seeing. But it's early days still. And again, it could be confounded by the fact that we're seeing largely, we're seeing more cases in younger people who tend to get less severe disease in general.
I mean, in a way, it seems very different to say this is what's happening in this wave here. But it's also quite similar, if I understand it, to what's happened in well-vaccinated countries. I'm talking about, say, the UK, perhaps the European Union. I mean, in the UK, as I understand it, you have a very high number of new cases each day, but you don't have a very high number of hospitalizations.
Exactly. And you're seeing this play out in the United States, where you've seen this incredible polarization about feelings about the vaccine based on political views. In highly vaccinated areas, you're still seeing waves of cases, but you're not seeing those hospitalizations and deaths, whereas in the unvaccinated parts of the U.S., you're definitely seeing those waves, and those waves are being accompanied by waves of admissions and also waves of deaths.
How long will it be before we sort of know where we are? I mean, we want to make predictions. People want to know exactly how to prepare hospitals. We don't want to lose people like we did in the first, second, and third waves. We lost so many people in those waves to COVID-19. And I imagine we still actually, the scientists, have a lot of work to do before we know where we are with this wave.
Right. So we're seeing, we've been told, it's going to take about a month to several weeks at least for all this kind of work that's being undertaken, not only in South Africa, but across the world, to figure out how Omicron reacts to the vaccines we have, and what kind of symptoms that we might be seeing with it, whether there is a change at all, if at all, in those symptoms. And I think what we're really hearing is this call to get vaccinated, because it seems to be providing still strong protection against hospitalization and death, the things that you want to avoid. Also, you being vaccinated decreases the likelihood that you'll pass it on to other members of your family. We know, for instance, that we are seeing those uptick in cases among younger children who are not yet eligible for vaccination. So being vaccinated is a good way of keeping younger members of your household protected. I will just say that I know that there was a lot of panic about those numbers. We did hear from Gauteng and from the NICD last week that those pediatric cases that you're seeing tend to be uncomplicated, so children being admitted for a couple of days and going home. So still early days, and quite a lot that is still unknown.
I mean, in a way, this is going to be about the efficacy of the vaccines, but it's also going to be about how people have already been exposed to the virus. They might have been exposed to the Delta variant, but their bodies also have immunity, which means that this wave is going to behave very differently anyway, presumably.
Well, that's the big difference that we might be seeing with Omicron, is that it might be more likely to be possible. What scientists are sort of telling us right now is that having been infected with the Beta or the Delta variant may not confer protection. So that's part of the reason that they think that we're seeing these big increases in waves, is that past infection does not necessarily guarantee you immunity from Omicron. And that's one of the things that scientists will be looking to know more about. But certainly early evidence shows that just having been contracting COVID earlier in the pandemic may not protect you from this new strain.
It's also about planning for hospitals, planning what hospitals are going to do. Authorities here and around the world have a lot more experience in doing that. Doctors know when a patient is going to need this kind of care if they're suffering from COVID-19, simply because they'll have seen it before, unfortunately.
Right, and you're seeing Gauteng prepare for this kind of surge in cases. They're still thinking that we might need 4,000 hospital beds at the peak of this wave in Gauteng, which is still a considerable amount of beds. So I think you're seeing provinces take steps to increase their health care worker ratios to make sure that they have enough for when people need to sub out or get sick, but also being really on top of oxygen supply. So Gauteng telling us last week that was a big indicator and a big factor in the last waves. So they'll be having daily meetings with Afrax, which is our major oxygen supplier in South Africa, as the wave progresses.
And in the meantime, of course, we can protect ourselves from the virus if we behave properly.
Definitely. I think this is, if you haven't gotten vaccinated, get vaccinated is definitely the message that we're hearing. I think you're seeing people react to it in these big turnouts with the boom of vaccination weekends, but also it's something that you're seeing around the world. In the United States, pharmacies can't keep up with the demand for people who are now looking to get vaccinated in the face of this new strain.
Nora Lopez Gonzalez, the health journalist, thanks very much indeed. Really do appreciate it.